live streaming now. Good afternoon, everybody, and welcome to the April meeting of the Wye Valley Trust Board. Thank you to those of you who are making time to watch either live or on a catch-up recording. For the interest of accessibility, we're choosing to continue to do these meetings in public, as we know that enables many more people to join. We've had a very busy morning this morning. We've had a workshop we're discussing a number of issues, including how we ensure we're using public resources as sensibly as possible, looking at system productivity, but also our own financial responsibilities. So we start. I'm Frances Martin, sorry, I should have said at the beginning, I'm Deputy Chair, and in the new board cycle that we have, once a quarter, I will be chairing, supported very ably by Jane Ives, our Managing Director, and the rest of our board colleagues. We have a number of apologies for this meeting. So Russell Hardy, our chair, Glenn Burley, chief executive, as per the agreed cycle of meetings, but also two of our non-exec directors, Sharon Hill and Ellie Bulmer. I don't think we've got any more apologies, have we, Erica? No,
no, Chair.
Okay, thank you very much. Does anyone have any declarations of interest that they would like to make for this meeting? Okay, so we will start with, oh, apologies, Alan.
Yeah, just to say I've got a new declaration. My wife is now a employee of Taurus Healthcare.
Thank you, Alan. Erica, your hand went up and went down. Was that a reminder for Alan?
It was just if you hadn't seen Alan's hand.
Okay, thank you very much. One of the nicest parts of this meeting and our role as directors of the board is to be able to celebrate some of the exceptional contributions that our members of staff make. And I think we are joined by some colleagues. I can see Maddie on screen. I can't yet see other colleagues from the chemotherapy team, and I can see Amy with Kate. So let's start in no particular order, but where you are on the screen. So Amy Symes, regular attendees will know Amy is our Head of Midwifery Associate Director, and next to her on screen is a very special colleague who has has received a national award from the Chief Midwifery Officer. So Kate Harding, congratulations, welcome to the board. Thank you for making time in your day to come along. So Kate, I'll read you the commendation and the submission that was made that supported her success winning the award. Kate is the epitome of a skilled and professional maternity support worker, highly skilled, dedicated, and sets the best example to her colleagues across maternity services. Kate has a positive, can-do attitude which she consistently applies on a day-to-day basis in her work. Employed as a maternity support worker since 2007, Kate has gained skills across a range of maternity service areas and has been working in the community setting for a number of years. Over the last year, Kate has extended her skills further, taking the lead MSW role in our newly launched complex feeding and tongue tie service. Kate is always seeking personal development to enable her to be the best she can be in her role. She has contributed positively to the task and finish groups to ensure the launch of the new services are effective. Thinking critically and innovatively, she identified means to improve the user experience at every opportunity. Kate utilises her role in community to provide support to mothers and babies with complex feeding issues, and then through her role in the tongue tie service is able to provide continuity to those patients. She is passionate about continuity of care, and we all recognise the benefits, including improved clinical outcomes. We receive lots of positive feedback from the team, and in particular women and colleagues identify Kate as standing out with her skills, her compassion and her overall approach to her role. Kate is very organised and is good at looking up and ahead, taking a proactive approach to the needs of the women and families and those of her team. Often you can ask Kate to undertake a task and she's already completed it. This, of course, enhances the efficiency of the team and impacts positively on her colleagues and on women and their families. evidence and testimonies were provided, and that obviously meant that she was a with us. So we're hugely grateful, very proud of you, Kate, and keep up the good work. Thank you. Thank you very much. Anything you want to say, Kate, or you just want to smile and depart?
No, that's fine. Thank you very much. Thank you for having me.
Thank you, and thank you, Amy, for supporting her, a living example of our trust values, and well done to you. Thank you very much indeed. You are very welcome to stay for the rest of the meeting, but quite understand if you've got other things that you need to do. So moving on to our usual Going the Extra Mile awards, and have we been joined by the chemotherapy team? Can't see them.
I don't think we have, Chair.
No, okay. So let's start. Maddie. Maddie, can you come on screen for us?
I'm actually in Ross Community Hospital, and I've put my camera on and it says it's on, but I can't see myself. So I do apologise, and I have to say you're not missing much. So I am here. But
well, I'm sure that's not true. we can see you and we can hear you clearly. Thank you. So Maddie is our employee of the quarter. Maddie has gone above and beyond whilst working with a student to respond to a need where clinical staff with English as an additional language adding cultural communication tools in an English NHS context. Maddie set in motion a resource to help clinical colleagues writing a leaflet called All Clear that covered paralanguage, non-verbal communication, open dialogue and tips for enhancing communication. Maddie also initiated a group of engagement volunteers to provide dementia patients with meaningful activities for social interaction and well-being, and collated a communication box that contained infection prevention and control friendly games and art therapy colouring for each of the frailty wards. What was supposed to be a one-time event, we called on Maddie to assist with our first induction and to co-present a module based on her All Clear leaflet. However, we now see that Maddie is as a perennial co-presenter presenting a module on mealtime support. Maddie does not accept second best. She's extremely well motivated and looks for excellence to equip others towards that aim. She's a proven team player by volunteering in her own time outside of her busy role within Wye Valley Trust. She shows compassion and respect for patients. Well done, Maggie. Thank you very much. Keep up the exceptional work. Thank you very much.
Thank you. Thanks for the chair. It's a great joy to see volunteers growing in confidence when I see them again and when they're working with patients with dementia. And I think it's a really important role. And don't forget, they are our workforce of tomorrow. So we need to encourage them as much as we can. Thank you. I won't stay for the rest of the meeting. Thank you. I've got a vulnerable patients group, so I promise I am doing something useful. Thank you very much.
And thank you, Maddie, and thank you for what you've just said about volunteers. It's absolutely at the top of our agenda. So again, for members of the public, we have need and roles in every bit of our organisation and across Herefordshire. So if you'd like to get involved, make a difference to people, then do contact us, and the details will be on our website. Thank you very much indeed. So I don't think we have the chemotherapy team, but I will read out, as they are the team of the quarter, the chemotherapy nursing team. The chemotherapy team have maintained the service throughout a very difficult 6 months. Long-term sickness in a number of key posts has meant that Ruth, Jodie, Hannah and Tracy have had to share management responsibilities in order to maintain the smooth running of the chemotherapy suite. All this and continue to provide the same level of clinical input. Despite the increased pressure these nurses have endured, each has demonstrated a determined resilience to uphold our trust care values, particularly accountability and excellence. They've all gone the extra mile to ensure that patient care does not suffer, and other staff members have continued to feel supported. We want to thank them for their hard work and resilience during this challenging time. They've shown outstanding teamwork and should be really proud of themselves. So thank you very much indeed to the chemotherapy nursing team. And just another quick one, we had a runner-up for the employee of the quarter for Ericsson, his 6th day on Wye Ward, and this was a patient, can you imagine, I was beginning to feel a little bit cabin fever. That particular morning, Ericsson rocks in bright and breezy. You can't help but have a smile on your face even when you're feeling awful. Challenging day on the ward, very difficult shift, but Ericsson did not allow his struggles and worked hard and kept a smile on his face. No moaning, looked like he needed to sit down, just got on and did the very best thing. So his attitude to work makes being in hospital so much more bearable. He never tells you cannot follow through with something. Such a trooper, and having a smile on his face and a spring in his step. So well done. I think we would all recognise how hard it is sometimes for our team who are working so hard to continue to be enthusiastic, to be kind, to be energetic, and to keep a smile on his face. That is so crucial to the well-being of all our patients. So well done, Ericsson. Thank you very much. Right, to business. So next item on the agenda are the minutes of the meeting of the 7th of March. Has anybody got any matters of accuracy that they would like to make as a change? I will take silence as a sense that they are accurate. Thank you very much indeed. So the action log is on page 19 of the pack. The first one, thank you, Katie. A meeting was arranged to look at the cash plan. Alan, Chief Strategy and Planning Officer, circulated, thank you, the climate change adaptation plan to the Foundation Group, a critical piece of our work. We're very focused on trying to make sure we do the long-term things as well as the immediate ones. Apologies, Lucy, did you want to come in?
No, sorry, I put my hand up marginally too early. It's in relation to the next one, Chair.
Well, keep your microphone open. Tell us about the next one.
Yeah, so I don't think what's put in the comment answers the question, but I have got the information that was requested at board last time. So just very briefly, no service users under the age of 18 responded to the maternity survey. 7% were between the ages of 19 and 24, 21% between the ages of 25 and 29, 43% between the ages of 30 and 34, and 29% over the age of 35.
Thank you, Lucy, very much. The staff survey is on the agenda, and the other action for Alan that was completed and within the minutes. So any other actions that aren't included? No. Okay, so in that case, we'll move to the Chief Executive's report. Jane, which particular bits of Glenn's report would you like to pull out for us?
First of all, a thank you to Glenn for writing it, because although he's not here, a lot of the things that he puts in his chief executive report are pertinent to all four trusts, and so it's really helpful for him to write it when he's not going to be here. So he starts off with around the staff survey. We obviously got that on the agenda today, so we'll cover that in a bit more detail. But he points out that actually 3 of the 4 trusts in the group are in the strong and improving quadrant for staff engagement. And the newest member of the group is the one that hasn't made that move yet. And certainly I've worked with Glenn since 2003, and it's something that's always been really strong focus for him, is around making sure that we focus on staff experience and we focus on staff engagement. So it's in a sense, it's no surprise that it's a strength for us all. When he wrote the report, we hadn't had the operational guidance that came out at the end of last week, but we had the budget, and the budget really is what we call flat cash in the NHS. So basically, there's no additional funding for growth. It's really funding the things that were funded in the previous year. But of course, we do see growth in demand, and it does assume that inflation is going to stay at the place where it's predicted to be. So, so it makes it a challenging financial future that we face this year. And again, we'll come back to that later on the agenda under Katie's section. What is really pleasing to see in that budget, though, is the additional investment in digital. We've got a long way still to go in the NHS in terms of really having state-of-the-art, fit-for-purpose digital systems for staff and for patients to engage with. So that's really good to see. Since you wrote the report, though, we say we have had the operational guidance out now, and most of it had been well trailed. So I think we pretty much knew what was going to be in there in terms of our urgent care targets, our cancer targets. I think what was a little surprising is that our elective targets, our waiting time target, we've only really got a target till September, which is to eradicate 65-week waiters by September. So as we look at our financial plan for the rest of the year, we're going to have to look about how ambitious we can be at reducing our waiting times. So that's still going to be some work that we do over the next few weeks. The other target that's quite interesting in there is the outpatient target around the proportion of patients we see in outpatients who are new or are having a procedure as part of their outpatients. We've been set a national target of 46% on that. Previously, we've looked at user follow-up ratios and tried to reduce the number of follow-ups. So this does this, I think, probably in a more sophisticated way. We've had a look at our initial data on this, and we look like last year we were at about 45%. So we are almost at that national target already. The other thing that was in the budget is around productivity and what the NHS has signed up to in terms of productivity targets over the next few years. That's something that we've already been focusing on a lot. When we talk about our cost improvement plan, we talk about our cost and productivity improvement plan, because being efficient and effective is more than about taking cash out. So we'll continue to build on the productivity work that we currently do. We've got two sort of forums really where we discuss that on a really regular basis. Our Valuing Patients Time Board, which is really about our emergency productivity, and we talk about our productivity board, which is more around our elective productivity, so where we look at theatre utilisation and those sorts of things. So we'll continue to work on those, and we've made some progress, but we've got more to deliver. But also in Glenn's report, he points out we're going to be doing some cross-group work on productivity as well, which will look at some of our what look like outlier specialties and do some of that work together, because one of the things that the group gives us is that opportunity to do some benchmarking to level of detail between individuals and teams that can get to know each other. Some of the national work, sometimes you don't get quite that depth. And then the last thing is around our Foundation Group Improvement Week. So we ran the first one of these last year, and it was an opportunity just for right across the group for people to share and celebrate some of the innovations, some of the improvements, some of the things that we've been working on. And again, that just shares that good practice. So I think those are probably the main bits out of the report I wanted to pick out. And obviously the Integrated Care Division has put in some their update on what's going on in their division. But happy to take any questions.
Thank you, Jane. Questions or comments for Jane? Nicola.
Yes, just to say on the improvement week, if as NEDs we can be invited to any of the sessions, I think that'd be really useful, especially now bringing in the fourth member of the group. So that would be great.
Yeah, we'll absolutely make sure you've got an invite to all of that.
Thank you. And for those people that don't already join either Transformation Tuesday or our sister publication, if you like, Safety in Sync, we are, as Jane said, we're really keen to learn from others and to share good practice. It used to be called plagiarism. It's now sharing good practice. We absolutely want to make the most of all of the opportunities and to learn together as a system and across our foundation group. Thank you very much. So, Jane, moving on into some more of the business, would like to introduce the Integrated Performance Report.
A few things to pull out on this, and I think it's a fair assessment to say that we've finished the year with some pretty strong performance actually across a number of really important areas. Jeffrey's going to go through the staff survey in some detail, but there is one thing that I wanted to pull out of that, which is our what's called our autonomy and control. So there are a series of questions. There's 3 questions in the staff survey that talk about how much staff feel empowered to improve either to suggest improvement in their area or to actually make improvements in their area, and we match the best nationally on all three of those measures. So that's, again, it's a really strong indication of that staff engagement culture and staff feeling that they can make a difference and they can make improvements in their place of work. So that's something just, I think, particularly proud of, and particularly proud of the management teams who create that environment and that culture in their teams. So we're going to, in the report I put, we're going to finish the year with around 100 patients over 65 weeks. That ended up near 150 actually. It was difficult to predict in the last in the last couple of weeks. That's still quite a good result. As I say, the operating framework target is by September to have got to 0 over 65-week patients. So we've got 150, and obviously there's a series of patients behind that who've been waiting 62, 63, 64 weeks. So it's not just about treating 150, you've got to keep going down the waiting list. But that does put us in a good place, and I'm certainly confident that we'll meet that target in September, and certainly well before that. What isn't in the national target framework is around patients who wait over a year. And actually this year we've reduced our number of 52-week patients from just over 2,000 to just under 1,200. So that's really a significant improvement. 800 people, who were waiting over a year, who are now under a year. So some good continual improvement on our waiting times. The other area where we've made some good and interesting progress is in emergency care. So March brought about a real focus across the NHS to really drive everything we could possibly do to improve waiting times for patients in urgent care. So we had some additional resource to invest, and we certainly put we always put a lot of focus in, but even more focus onto everything that we could do to improve waiting times in ED. And we've improved our performance by about 11% from where we were in January. That means we're certainly in the top 10. We haven't got exact results yet, but we're expecting to be in the top half dozen so nationally in terms of the improvement we made. There was a cash incentive with this, so we will have earned around £2 million of capital to spend in the current year as part of that incentive scheme. And in the operating guidance, it looks like that scheme is going to run again for the year that we're now in, although the terms of it yet to be agreed. And so some good performance, but we were coming from a low base. And so there's lots more improvement that we need to make on our urgent care pathways. And it's also one of the priorities for our One Herefordshire work, so where we work together with all of our partners in Herefordshire. Improving urgent care is an absolute priority because it is a system measure and not just a measure of A&E. Saying all that improvement, we have still got a lot of we have a number of patients who are boarding on our ward, so sometimes that's still going up to that 30. It's come down below that again today, but that's a lot of patients outside our normal bedded footprint, and there is a very significant quality impacts for patients and for staff experience of that. So whilst we've made some good improvements, really what we're aiming for this year and driving towards is to eradicate boarding patients at all. That would be a good result for us to deliver over the course of the year. So I think that's probably the main features that I wanted to bring out before handing over to colleagues.
Thank you, very comprehensive. Any immediate questions for Jane that won't be picked up in the individual sections? Nope. Okay, so let's move on, starting with quality and safety. Lucy, who's going to kick us off?
I'll kick off and I'll hand over to Chiza, but just a brief report from me this month, but just the report summarises the Q3 position for our sequins, the sequins that were built into the contract for 23-24, and it's pleasing to note that we achieved all of the sequins with the exception of the flu vaccination sequin for frontline staff. We're not alone in not achieving this. Many NHS organisations experienced a low uptake of the flu vaccination this winter in comparison to previous years. And that's felt to be due to the additional vaccinations that were required during COVID. The flu campaign for 24-25 has just been launched, ready for this winter, so it's going to be an area for focus for us in the forthcoming months. Although we don't on a quarterly basis have to provide our performance against the communication with the community pharmacists, we do track that internally, and we're certainly on track to achieve that at the end of the whole period, at the end of Q4. And just to note that the sequin programme for 24-25 has been paused, subject to a review. The staffing information is within the report for information, but I'm happy to take any questions at the end. And then I just wanted to touch briefly, if I may, on the PLACE results. So just for colleagues, the PLACE survey is an annual survey that's conducted in partnership with service users and volunteers. And what's included in the pack is our scores across each of our sites, so each of our hospital sites, Ross, Bromyard, Leominster and the county site here in Hereford. But we also provide a comparison to colleagues within our ICS, so Hereford and Worcestershire Community Health and Care Trust and Worcester Acute, and then also across the foundation group. I think it's pleasing to note, given our previous challenges around cleanliness, that it's pleasing to note across all of our sites that we're above the national average score or just a little way off it, which is good progress. Food service is sort of where we expected it to be. So food is measured by 3 domains. There's an organisational survey that happens prior to the PLACE survey. Then the food service is observed for how we deliver and present our food to patients, but then also the taste offer. And unsurprisingly, where we score below the national average and where we need to improve is around that, what we offer our patients, what it tastes like and what it looks like on the plate. And I know that Sodexo colleagues are focusing on improving those elements. You can see in the pack that we're well below the national average for the areas that relate to privacy, dignity and well-being and dementia and disability. Now, if you look at that, we're not alone in that, so do our foundation group colleagues. Some of that's because it's due to the estate that we are operating within, and therefore it's difficult to address that to improve our scores. So examples of that would just be the number of accessible toilets we have, the fact that not all of our wards have a day room or a separate sitting space for patients, and that we don't have separate treatment rooms on our wards for carrying out treatment. Therefore, we do treatment in the bed space. We don't have audible lifts telling patients what floor they're on and where they are. And we don't, in all of our settings, offer free entertainment to our patients. Now, they're quite difficult things to put right, but certainly lower our scores in relation to those domains. Some are more easy, and we do need to focus on signage, the colour of our paint contrasts so that it's dementia friendly, the clocks that we put in our clinical settings to be dementia friendly, and certainly a focus on the maintenance and condition of our external spaces, so our gardens and courtyards, particularly in our community hospital sites. So in relation to next steps, we've got a working group that are prioritising the number of actions that we need to consider. And from this month, we'll be introducing a rolling programme of what's called PLACE Light, which means that we continue to use the audit tool to assess areas on an ongoing basis, so that we can make sure that we focus on those areas where we need to improve. And I'll hand over to Chizo, and then, as I say, I'm happy to take any questions at the end. Thank you.
Thanks, Lucy.
Thank you, Lucy. So just to bring you up to date with our mortality, our latest 12-month rolling mortality indices, which is our SHIMI, which brings us up to October, remains within the expected range at 101.4. we still continuing to focus on our outlier diagnostic groups, which include heart failure and fractured neck of femur, looking at our coding and looking at ways that we can improve care. Key highlights since the last time we met is we've made great progress and are now ready to roll out medical examiner services across the community. So we've developed the mortality module on in-phase, and we have made contact with our GP practices so that once it's mandatory for us to scrutinize all community deaths, we are in a position to do that. Some of the other improvements we've done is we are working on setting up the Learning for Deaths committee, and to that effect, we have appointed mortality leads in all our specialties to ensure that they are reviewing deaths in their specialties and learning from them. And so the committee will be an assurance committee so that they can present the trends and the themes and what quality improvements they have put in place as a result of their review. We are having a training session at the end of April, and the first meetings will start in May. I'm happy to take questions.
Thank you, Chizo, and apologies to members of the public that I think that some of that data wasn't included in the pack, but it will be made available if people would like to see it after the meeting. So, colleagues, any questions or comments for either Lucy or Chizo? Ian.
Yeah, thanks both. Just a couple of observations on the PLACE report, Lucy. First one, actually, I just wanted to commend Ross Community Hospital because although there isn't a great variability in the different PLACE scores across our sites, it's probably fair to point out that Ross has gone from bottom of the league, as it were, last year to top of the league in 2023. So I'm sure colleagues at Ross would be happy to have that pointed out. And the second observation was to do with follow-up work that you mentioned around things like dementia, disability, and dignity in care, and it refers to a process to address that. But I was struck by the fact there are Going the Extra Mile winner, Maddie, earlier, shows us kind of what enthusiasm we have among many of our staff actually to address some of these challenges that we have. So it's a plea really that although we will go through a process to assess what we can prioritise and what can be done, actually let's involve those frontline staff who are really in a position to help us with a lot of this.
Yeah, very well said, Ian. I completely second that. Lucy, do you want to come back?
Yeah, I think it would just be worth noting that the group that Maddie said she was going to next, which was the vulnerable persons group, is the group that are focusing on the findings from the privacy, dignity, wellbeing, dementia and disability scores within the PLACE audit. So it will be those frontline colleagues that will help us to prioritise what we need to do and what we can do to make it better.
Great, thank you. Okay, moving on. Andy, Jane gave a very good introduction. Anything that you would particularly like to pick out from an activity perspective?
Thanks, Chair. Yeah, just 4 things from me. Just want to, in terms of sort of reflections on what's gone well, is we're now officially in British summertime, and I'll reflect back on the winter and a difficult winter period, and reminding colleagues and the public that we've had significant challenges with industrial action, etc. over the winter period. Just our SNAP, which is our Sentinel Stroke National Audit Programme scoring. That's the measure of how well stroke care is being delivered in the NHS across England, Wales and Northern Ireland. We're at a level A. The first time we've achieved a level A, which is the highest grading of SNAP scoring that you can achieve for October for December, which is a significantly impressive when we were faced with industrial action and entering that winter period. And even more staggering when we were only one of 2 trusts across the Midlands that achieved a level A, which is a significant achievement for a trust our size and the challenges that presents. Secondly, my report I just mentioned about the frailty same-day emergency care team that have been highlighted as good practice by NHS providers in their March publication, Health Service Innovation into Supporting People with Frailty. It just flags there again how our frailty team are improving the benefits to our elderly patients across the acute floor with positive feedback and experience for those cohort of patients. Jane's already mentioned the 4-hour emergency access standards and the challenge we were faced in March and how we were one of the most improved trusts in England. Just wanted to express my thanks for the efforts across all our divisions in achieving that. But the big thing for us now is the learning from that March period, what we can embed, what we can focus on, and what we need to build on for 24-25, so we can achieve 78% in 4 hours for 24-25. And then lastly, I just want to mention about cancer. So in my report, cancer is always reported 2 months in arrears, so looks at January, which was particularly challenging. Although our faster diagnosis standard within 28 days improved to 72% from a low of 65% in November, and our 62-day patients that started treatment was topped 142 patients in January this year. We've made significant improvements with that across February and March. So for February and March, our faster diagnosis standard was 79%, so a significant improvement, and we've got to deliver 77% by the end of March 25, which puts us in a good stead, and a good stead to achieve 80% by March 26, which was in the recently announced business planning guidance. But also the number of patients that waited over 62 days for treatment reduced to 62 by the end of March, which was below our trajectory of 71. So a real significant achievement in the last 8 weeks in our cancer performance, and a real sound base to build on as we head into next year. Thank you, Chair.
Thank you, Andy. Questions, comments for Andy? No, so a couple of things from me. Some really impressive improvements there, despite some of the particularly external factors that have affected the smooth operations of our services. So I'd like to formally thank you and all of our teams, operational and clinical, and all of the behind the scenes team who make stuff happen. It has been a winter unlike any other, I very much hope, and you're just commending all of you and the teams for resilience and determination to continue to live our organisational values, to provide the sort of care that we want for our families and friends when it is really tough some days to be able to do that. And we spend a lot of time providing the sort of care that we don't think is good enough, but we continue to hold on to the commitment to strive to make sure that it continues to be so as much as possible. So thank you to everybody. I'm delighted that you've pointed out it's summer. Look forward to some warmer weather and some slightly lower demand for our services going forward. So thank you, and particularly around stroke. It is a phenomenal achievement for a small rural organisation to be able to provide that level of absolutely life-changing care for people. Jane.
Yeah, just one question, Andy. I say it has been a really strong couple of months of delivery. How confident are you, particularly with the cancer work, that that's going to be sustained and we're going to stay at this much better delivery point?
I'm relatively confident, Jane. I think it's required a significant amount of effort on the division's part. I think now we're there, now we're using the information we've got in a far more structured way. I think our cancer manager, Kat Barker, has put a really good foundation in place, working alongside the divisions. I think we're in a good place. I think it will be rocky. I think we will have good months and bad months, but overall we should be able to maintain and build on that level of improvement.
Thank you. We'll make sure we note that. Thank you. Jeffrey, what would you like to pull out in relation to our workforce?
Oh, thanks, Francis. In terms of the workforce KPIs, we're starting to see a reduction in sickness absence, and I am confident that the interventions we are putting in place should see a reduction in sickness absence over the coming months. We've also developed the new health and well-being strategy, which is on the agenda. But the strategy is all about calling on employees, our colleagues, to take more ownership and responsibilities for their health and well-being, because by maintaining your own health and well-being, you're playing an active part in terms of trying to provide an excellent service to our patients. So we'll come back to that as part of the well-being strategy. Through our divisional recruitment and retention working groups, we are maintaining low staff turnover and taking active steps in terms of filling our vacancies, as can be seen within the paper. Considering the holy month of Ramadan, we provided some guidance to our line managers in terms of supporting our Muslim colleagues, and also just to show our ongoing commitment to equality, diversity, and inclusion. The results of the staff survey are very positive. James covered that, and there's a paper on the agenda, so I'll come back to that. And finally, from our perspective, in terms of performance appraisals, we've now written out to all divisional leaders asking for outstanding appraisals to be completed by the end of June. And this will be picked up through the monthly finance and performance review meetings. So I am confident that we should also see some movements in the right direction in terms of performance appraisals over the coming weeks. Those are the key highlights from our report, Chair. I'm happy to take any questions.
Thank you, Jeffrey. Questions or comments for Jeffrey? No, really good stuff, and we will, as you say, discuss the staff survey shortly. So moving to finance performance, which I will preface with a welcome back to Katie. Delighted to have you back with us, and also to formally note very significant thanks to Susie, who did very well to step in to cover whilst you were off. And having said that, you're now going to tell us that everything's lovely, Katie.
Thank you, Francis, and thank you for the welcome back, and I'd echo those thanks to Susie and the team for stepping in into at short notice. In terms of the finance section of the IPR then, so just a couple of headlines to bring out today, and I just want to touch on the 24-25 financial plan as well. So in terms of the report that's in front of us today, it covers up until the end of February, month 11, so almost the end of the financial year. And the deficit year to date stands at £12.7 million. So that is adverse to plan, but remains in line with the revised forecast. And the forecast was revised at month 10 following confirmation of some additional national support. And we've heard already that we've maintained strong elective performance throughout the year and benchmarked well on our value-weighted activity. But we know that much of that is delivered at premium cost, and therefore that ongoing focus on productivity is really key, that we touched on this morning in workshop. In terms of our efficiency programme, we've delivered just under £8 million of financial improvement year to date. It is less than we'd expected and planned to deliver, and we've of course inevitably been impacted by some of the challenges this year, such as industrial action. In terms of cash particularly, I'm pleased to see that our prompt payment performance has improved in February. We had a bit of a dip just before Christmas, but that's improved. And our cash support requests that we've been making nationally linked to the deficit have all been supported to date, and a further application has been made and is being processed for Q1 at 24-25. I would just ask if we can make sure in the minutes, as usual, as we've done previously, if we can endorse the ongoing submission of revenue support requests linked to our cash flow requirements, because it's part of the process that we've got that board endorsement. If I touch on 24-25 then in the financial plan and budget, so James already alluded to the fact that planning guidance was really late coming out this year. It only came out last week, but notwithstanding that, broadly we knew what we were expecting, and the usual planning process has been undertaken within the organisation. Over the course of that planning cycle, board will have been updated on the financial plan and the assumptions that underpin it, and our final plan was submitted last week and reflects a deficit plan of £36.8 million in 2024-25. Ordinarily, that financial plan, the final version of it, and the corresponding divisional budgets would be brought to this board meeting in April for ratification. But as you'll appreciate, due to timing issues and late guidance coming out, they're not here today in the pack, but that will be brought into next board meeting for completeness. Notwithstanding that governance step, though, I'm confident that our divisions and directorates have been fully engaged in that planning process and are clear on those financial parameters within which we're expecting them to operate for 24-25. Happy to take any questions, Chair.
Thank you, Katie. Very clear. Any questions or comments for Katie? No, it's been a very strange time. The usual Christmas present didn't appear. It was an Easter present instead. Kieran.
Just a comment, really a compliment. I mean, we've secured 13 million extra in month from national resources against a very challenged NHS financial position. Compliments to the team for securing that.
Kieran, I don't think it's unique to us, but thank you.
And of course, what we all want to do is to be in a position where we know how much resources we've got and have that at the beginning of the year rather than the end. But we're certainly grateful for that support to get us into the position that we are at the end of the year. Thank you, Katie. Okay, so let's move on. So we're now into the section of the board, which are items for noting and information. So it is a very comprehensive set of slides, a weighty tome, Geoffrey, around the staff survey. So assume that everybody has read it. What particularly would you like to draw to our attention?
Oh, thanks, Francis. Well, as you can see from the papers submitted, though, Wye Valley has had excellent results in the 2023 staff survey with above average scores in all key areas of the survey. We've seen significantly higher scores in 5 areas, namely learning and development, flexible working, staff engagement, staff morale, and we are still seeing significant improvements in all key areas of the survey. I mean, these improvements, I must say, are down to the concerted efforts that we've put in terms of leadership and management development, health and well-being, and ongoing staff engagement. The paper covers the staff groups and divisions with lower scores and actions to be taken locally with local leaders over the next few months. We've also seen significant improvements in the surgical division. I think it's worth noting that, bearing in mind last year, we had some real concerns with the surgical division. That goes to show the importance of good leadership. And I'm also pleased to see the feedback that our colleagues have provided in terms of the support from their immediate line managers. As Jane mentioned earlier, the line managers set the context in terms of autonomy, in terms of control, and also in terms of the whole sense of belonging within a team. So I think that's very good feedback for the line managers within the trust. It is worth noting that Wye Valley has not been rated as being amongst the worst performing organizations in any part of the survey. So although we have some areas for development, overall, the results are very positive, and you can see excellent feedback in a number of areas within the survey. We are now amongst the top performing organizations in the Midlands, and we are closing in on Swift, because we look at the group results, Swift have always been the top, but we're not too far behind. So all in all, I think it's really good results for the trust. The HR teams and divisional leaders will embark on the 2024 Wye Valley-wide staff engagement campaigns. We started that last year, so we got a plan this year from May onwards for 3-4 months. There's going to be total engagement with teams across the board, so we can then get local teams to come up with local solutions to address some of the areas of concern within the survey. So the paper just highlights some of that, and also highlights all the ongoing work we're doing on the 8 elements of the people promise within the survey. So you can see that captured within the paper, and that work will continue. I think those are the key highlights I wanted to pull out of the survey. Happy to take any questions or observations.
Thank you, Jeffrey. And since we're talking about leadership, no small part thanks to your leadership and prioritisation of this. I'm definitely with our Chief Executive, Glenn. It is one of the most important bits of information that we get in the year. We are only as good as the motivation, enthusiasm, and commitment of our staff in the nicest possible way. The people around this table, couple of minor exceptions, don't do the hands-on care. The rest of our teams do, and we know the enormous difference that makes to people if they feel empowered, able to make changes in their organisation and in their working practice. So thank you for you and your teams for your leadership. Grace.
Thank you, Chair. Actually, on the same point as you around people feeling able to speak up and do that work. Firstly, Jeffrey, really appreciating the massive progress that's been made and all the good things that you pulled out. Just noticing under "We Have a Voice That Counts," the question, I feel safe to speak up about anything that concerns me in the organisation. That obviously isn't where we would like it to be. Is there anything you can take us through about our action or response to this, please?
Yeah, I think it's something that we're working on with the new Freedom to Speak Up Guardian. So since she started in post, we've gone from 22 Freedom to Speak Up champions now to just about 100 or just under 100. So she's actively engaging with teams across the board. And I'm confident that over the next few months, we'll get more traction. And I'm convinced that next year, we'll see better scores in that area. So we're also providing training on civility saves lives, and we're doing lots more stuff than ever before across the board. So I'm sure we'll get better.
Thank you. Nicola?
Hi, Jeffrey. Well, first of all, can I also congratulate you? I felt that pain of trying to move before in my previous role. I was trying to move scores for engagement for this volume of people, and I think don't underestimate the massive difficulty in numbers that big and the number of people you have to influence. It's moving an oil tanker. But the one thing is, once you start to move that oil tanker and once you start to see those positive improvements that you're now seeing, nobody wants to go backwards, so you can get the momentum then and move it forward. So well done on that. I think that's just where we want to be, from seeing all the hard work you've put in the last few, well, not just last year, the year before, and it's not been normal times. So to do it against the backdrop you've done it, I think is really remarkable. The point I'm going to point out is, still, and I think it builds into a bit what Grace said, only 34% of our team filled this in. And we talk about everybody having a voice, and this is the place where they should have that voice and feel comfortable. It's not just for me about Speak Up Guardians, it's about the bigger picture. Average was 45%, best in class was 69%. And I think that's the bit I think we need more people saying that we're moving this forward, because then we turn the tanker into a speedboat. So that's just the bit I'd like to see us keep working on, Jeffrey. Thank you.
Oh, thanks for the comments, though, Nicola. Rest assured that Jen and I, we've had discussions about this, and we've got some plans in place to do that. And that will include potentially giving people time and also having more laptops, more facilities in work time for people to do the survey. That's just one idea of something we'll be introducing this year, but thanks.
Thanks, Jane.
People have taken the words out of my mouth. So it's one of Jeffrey's personal objectives this year to get it to 50%. So and he always delivers on his objectives, so I don't have any worry about that. But it is really important, Nicola, as you say. The second thing was about the freedom to speak up. I will absolutely eat my hat if this hasn't shifted this year. We've had a real step change in energy and engagement around freedom to speak up with Joe Sanford, our new Freedom to Speak Up Guardian. So if the workforce hasn't noticed that, I'll just be very, very surprised. And she's doing some work at the moment on, in fact, a number of us have just recorded some videos to go out to staff that says what it means to us as execs to have freedom to speak up working, because it really works for us and it tells us things that we don't know that we need to act on. So lots of work on that. So I'll be so surprised if it hasn't shifted next year. And then my last comment was again that sort of that leadership point. And I think when we come to the divisions, it's and the specialties of staff, there's some quite interesting changes in there. Jeff's already said about the surgical divisions really come up with some really good leadership in there over the last year. But equally, our medical division has gone down since Andy was in the division, and he was and actually was always a bit of a shining star. And we've had sort of some unstable leadership in the medical division, and whilst they've also borne the brunt of the pressures in A&E and boarding on board, so it's to be expected. I think there is some sense of that. I've got real confidence in the leadership team that we've now got across the medical division, and I think that'll make a difference. And the other one is the professional, scientific and technical, which is basically our lab staff and pharmacy staff, and this has always been lower than the averages across the rest of the organisation. And Ian and I went and did a walk around yesterday in pathology, and again there's a new leadership team, and I think it was palpable the sense of enthusiasm that we saw. So again, it's one to watch, I think, for next year to see if this one shifts. And then really good to see our nurses and healthcare support workers are at or above average in those scores. Again, that's really, I mean, this is a score against our own, so there's always going to be some below and some above. And our doctors is the last one. So we're doing quite a lot of work at the moment with leadership development with our senior medical staff, and so again I would hope that would start to be reflected in our scores next year. So I think we're doing a lot of work, and again I'll add my thanks again to Jeffrey for his leadership of this, but well supported by lots of other people. So I think we're tackling the areas where we can see there are weaknesses. But I'm always looking forward to see what next year's looks like, because there's a lot more work going on.
Thank you, Jane. So just for members of staff that are listening and watching, if you don't know how to speak up, there are posters and things all over the place and all the information on the internet, but any member of the executive team and indeed of the board, if you have anything that you are concerned about, don't worry about the process, about how you do it. We want to hear from you. So we definitely, we're not hiding behind anything. We want the culture to be as open as possible. This is about our family and friends. One of the great strengths of Herefordshire is the number of people who live and work in the same place. So these are our services. These are our families. This is what we need to do. So anything that you're not happy with, and heard a very encouraging story about somebody who was prepared to put their hand up and have a discussion under the Civility Saves Lives, being kind to each other, being kind to our patients, and calling out when things aren't as they need to be. So that very much is the culture we want to endorse. So we've noted some particularly challenging objectives for individual members of the executive team, and we'll look forward to hearing about those in due course. And of course, Jane, you realise that all of the exec team's objectives by definition are yours as well. So on that basis, we'll look forward to this time next year. But yes, thank you to everybody. And we've said it before, but in the context of the extraordinary pressures that people have been experiencing, it is an enormous commendation, I think, to the culture of leadership and the expectations of quality that the results are as good as they are. But we are never complacent. And I'm sure we will have some colleagues from elsewhere in the group who understand how ambitious we are to be the #1 organisation. Not that it's a competition, but really we do think it's our turn to be at the top of the table. So thank you, Jeffrey. Right, it's the Jeffrey Show. Health and Wellbeing Strategy.
Thanks, Francis. The health and wellbeing strategy has been developed with members of the Wye Valley Health and Wellbeing Group, and it is being presented today really for information, because it's gone through the relevant channels within the trust, and it just sets out our aim to try and encourage every single colleague to take more ownership and responsibility for their own health and well-being, because we know that if you can maintain your own health and well-being, take some more actions, then that way then you will be able to attend work as best as you can to provide an excellent service to our patients. So the strategy uses the NHS Health and Wellbeing Framework and puts forward the enablers and health interventions, which are important in terms of trying to optimize the health and well-being of our colleagues. It also talks about everyone taking that responsibility for health and well-being. We can provide the support, we can provide the interventions, but fundamentally, people have also got to take some more ownership for maintaining their health and well-being with the right support. Hence why when you look at the strategy, we've got occupational health support, we've got staff physio, we've got the staff of mental health and well-being nurse, and we putting in actions in place through the Halo Leisure program just to try and support our colleagues. And we'll carry on doing that. So really, the strategy is just for information, just to show the steps we're taking to support our employees and also to address sickness absence and especially mental health conditions, which are still, unfortunately, one of the highest reasons why people are going off sick. So I would commend the strategy to the board, and happy to take any questions.
Thank you, Jeffrey. Any questions or comments? Grace.
Thank you. Yes, thank you, Ms. Jeffrey. Really appreciating all the work that's been done here and all the resources that are here to help people do that. We discussed this before, and I'm just wondering, do you have any timeline of when we might get some intel on what people's most common or most pervasive blocks are on taking that responsibility or taking the actions that they know they need to take for their health and well-being? Because everybody knows that we need to kind of exercise and do all these various things that are good for our well-being, and I know there's lots that are beyond our control as an employer. For example, someone's caring responsibilities, they might be very stressed or have time constrictions on exercise. But I think what's interesting is for us to look at what is coming back and then think, well, as an employer, we can't make somebody not be a carer, we can't magic up care workers, but we can, for example, give more flexible working, we can maybe refer to things. And so I'm wondering about what the intel is and what the blocks are and what is then within our power to do, because of course, just telling people to do things more that doesn't take into account of why they're struggling and what we can do for that won't be the most effective outcome for such a great project.
Yeah. Thanks for the comments though, Grace. What we will be doing going forward now is using the local intelligence from our mental health and well-being nurse and well-being champions. So they are out and about in all departments, speaking to people, trying to support individuals. So we will be providing quarterly reports based on that local intelligence, in addition to local intelligence from occupational health and also from HR business partners. So we're going to be using different forums to try and gauge what's going on locally. And Jen and I were talking about running more frequent local surveys as well. So that's something we're going to explore this year, and well-being will be one of the areas that we will focus on.
Thanks, Jeffrey. Ian.
Yeah, thank you, Jeffrey. Very supportive of this and seems like a logical next step, partly bringing together some things which we are already doing, but having it all together in a health and wellbeing strategy is really positive. Of course, a strategy is only as good as the actions we then take to implement it. So I wondered if you perhaps just say a little bit more about the way that we're promoting this across the trust.
Now it's gone to the board. We will be using this as part of we've got an HR roadshow across all departments in 2 weeks' time. So this will be part of what we will be promoting. And also when we do the local staff engagement programs, which I mentioned, which will run from May till August, the wellbeing strategy will also be part of what we'll be talking to staff about. So we're going to be using different avenues and also screensavers and different ways of trying to make sure that people are cited on this. So we've got plans in place to do that, Ian.
Thank you.
Thanks very much. Any other questions or comments for Jeffrey? No, well, we note it, absolutely support it, go and make it so. It is absolutely crucial. So anything that any of us can do to help, please let us know. We'll look forward to updates in due course. Thank you. Lucy.
Thank you, Chair. I'm presenting the standard perinatal quality surveillance model report for January. This is the standard report that needs to come to board each month. We're mandated to bring that, and I'm pleased to say I've got no exceptions to report from that this month. So therefore I thought I would just highlight a couple of things that we're really proud of. So yesterday I chaired our monthly maternity safety champion meeting, maternity and neonatal safety champion meeting, should I say. Francis, as our non-exec maternity safety champion, also attends that meeting. And that meeting is about receiving feedback from staff, from service users, and through different intelligence sources, so that we get a flavour of how people experience our services. And the Maternity Neonatal Voices Partnership, which is a group that comes together to provide the service users' voice on their experiences. They've recently held their quarterly meeting, and their chair fed back that our communication, support and engagement to our service users is really strong and positively received, particularly in the antenatal and postnatal periods, which is really positive because that's not always been the case. However, we've still got a little bit of work to do in that perinatal phase, so in the phase when people are coming into our care for delivery. What they were saying is that sometimes our communication, engagement and informing them and enabling them to have joint decision making with us isn't always where it needs to be. So that's an area of focus for us. We are, however, hopeful. Part of that feedback used to be around induction of labour. So when an individual finds themselves in a position where they need an induction of labour that they weren't expecting. And we have co-produced with our Maternity Neonatal Voices Partnership a video and information leaflet that's been launched in the last month to support decision making and understanding of that for our service users. Earlier at board today, you will have seen that Kate Harding came to board to be acknowledged for the fact that she received the Chief Midwifery Officer's National Award for her contribution to maternity services as a maternity support worker, and that's fantastic. But also yesterday, through the quarterly feedback from the Maternity Neonatal Voices Partnership, we also heard that one of our other maternity support workers, a lady called Mel Webb, consistently features in service user feedback about how she supports individuals, particularly postnatally, on our ward and then out into the community. We have planned our 15 steps of maternity and neonatal services for mid-April. This is something we carry out annually, and again it's where we bring service users into our services to provide feedback on their first impressions of the environment, communication and the feel of the services that we offer. So that's planned for mid-April. And I just wanted to note that in the last month the neonatal unit have received stage 1 for their baby friendly initiative, which is a fantastic achievement for the team, and we're just eagerly awaiting the baby friendly initiative stage 3 feedback for maternity services, but it is looking positive that we will achieve that also. And then just finally from me, just to note that the safety standards for maternity services, the CNST, the clinical negligence scheme, for trusts, which has 10 standards, has just been launched 2 days ago. So we're just reviewing that guidance with a view to committing to declare compliance against all 10 standards next year. Happy to take any questions.
Thank you, Lucy. Any questions for Lucy on the maternity perinatal quality surveillance? No, echo all of those, and I have to say that the MNVP, that user voice is so powerful in terms of really describing how it feels. So we are very pleased to have such an engaged people from, so Florence, who's chair, and we've just appointed another co-chair, so looking forward to strengthening that, and particularly in the kind of hard to reach groups and making sure that we're hearing from everybody using the joys of every sort of communication, telly and otherwise, and social media to make sure that we're accessing the right people to get the right feedback. So thank you very much, Lucy. Right, the final section are our committee summary reports, just for information for members of the public. We have a very formalised structure of board subcommittees where the detailed scrutiny of all of the areas of our work is undertaken. So we bring these reports just for information, but significant scrutiny has happened elsewhere. So Nicola, anything you want to pick out from the audit committee reports?
Lost my mouse, so nothing to add, but happy to take any questions.
Thanks. Any questions for Nicola on audit committee reports? I'll take silent as assent. So moving on to the charity trustee committee, and thank you very much to Grace for taking over chairing of this committee. Colleagues will note that Frank Myers, one of our chief non-exec directors, left us after a very significant period as being a non-exec at the end of December, and Grace has very ably stepped into his shoes. Anything you'd like to pick out from those summary reports and minutes, Grace?
Thank you. Nothing to pull out. The report is there and the details in the minutes, but happy to take any questions or comments.
Any questions or comments for Grace? No, so we'll move on to the quality committee. Ian, anything you'd like to pull out for us on the January quality committee?
Nothing to add, Chair.
Thank you very much. Okay, in that case, thank you very much, and we'll receive and note those reports. Has anybody got any other business that they would like to raise now? No. In that case, we'll move to questions from members of the public, and I think we do have a couple of questions from Chris Lewandowski, don't we, Erica? So thank you for Chris. Would you like to present those or read those questions on his behalf?
Yes, thanks, Chair. The first one, question 1, thank you for the response to last month's question on assaults upon WVT staff. I find this situation appalling. 71 verbal assaults and 66 physical assaults in 6 months, and only 7 warning letters from the trust to protagonists. What more can the board do to support its staff? Could you improve liaison with the police so they report back regularly concerning hospital staff assaults? Could or should the trust write more warning letters to protagonists? Will the board include the response from the request to the police made a result of last month's question within the minutes of this meeting? Should there be increased de-escalation and restraint training for staff? Could more security staff be available at times and locations where incidents are likely to occur? And finally, how many of the 66 physical assaults were RIDDLE reportable, and what was the feedback from the Health and Safety Executive on these matters?
Thank you. A very extensive and detailed set of questions there, Alan. I think it's with you to answer. How much of that do you want to do now, and how much would you like to do outside the meeting?
Well, I'll just give a summary response. I mean, the data hides a lot of nuance. I think the first thing I'd say is that multiple incidents are attributable to some individuals, so that's one of the reasons for the high number. I know that all of the incidents from one particular ward in that period were all down to one patient. I think the other thing I would say is that some of these relate to patients that are clinically unwell and do not have capacity at the time, so they aren't necessarily the sorts of patients that we would call the police or issue a warning notice. There is a good relationship with the West Mercia Police. We meet with them.
Oh, I think you've gone on to mute, Alan. Come back again.
Okay. We have a good relationship with the police. You only have to look at the Hereford Times this week. You can see somebody's been successfully prosecuted for verbally abusing staff in the trust. So you can see that we do follow through with that with the police. Warning letters are sent when we feel they're necessary, but if you look at our policy around escalation, we tend to try and resolve things informally, verbally, face to face with the patient or member of the public first before issuing warning letters. So not everybody. I'm sure we could do more, but actually we try to go for an informal response first. In terms of the training, we do have key staff trained. We are looking at potentially doing more. We had some funding to do some of that training a couple of years ago. We'd like to do a bit more of that. And we did implement a security service last year with our partners Sodexo, and none of the physical assaults were reportable. So a lot of answers there. Chris did ask a question about this a while ago, and there was a report that came to a board about 3 or 4 months ago that contains a lot of this information.
Thank you, Alan, very much. And we'll just reiterate, it is not acceptable for people who have capacity, who are just cross and frustrated, albeit we understand that, to abuse our staff in any way. But equally, we will always be sensitive to people's individual circumstance and want all of our staff. And the number of things that are reported is good. We always want to have a high reporting rate. We don't want staff to not tell us about issues so that we can make any appropriate adjustment to keep everybody safe. So thank you for that. I think there's another question, Erica.
Question 2. Wye Valley Trust is heavily dependent upon overseas trained nurses. Nationally, it's been suggested that a significant number of non-UK EU trained nurses are leaving the NHS for better paid jobs in countries such as New Zealand, Australia and the USA. It should be possible from exit interviews with WVT staff who are leaving to ascertain whether or not this is the problem for WVT. Is it? I understand that the government has now changed the visa rules for overseas nurses who want to come to the UK to work. This change removes the right for such staff to bring dependents with them. It is likely to be unpopular with applicants. How is this change anticipated to affect WVT's recruitment of overseas nurses?
Thank you very much. Jeffrey.
Oh, thanks, Francis. Well, I'm pleased to say that at Wye Valley, we have a very successful recruitment and retention program for our international nurses. So their retention rate is 94%, which is amongst the very best in the health service. So we're not seeing that type of problem within the trust. However, we are also conscious of the fact that we need to grow more of our own staff. So one of our strategic plans or ambitions is to grow more of our own qualified nurses, and we've got that program in place. So we should have more locally trained nurses over the coming year. In terms of the visa requirements, NHS organizations are currently exempt from the visa rule changes. So those changes don't apply to us. So overseas nurses are still able to bring dependents into the UK, so long as they work for an NHS trust as a qualified nurse. So for now, we exempt from those immigration changes.
Thank you, Jeffrey. Very clear. And again, our thanks to colleagues from overseas who choose to come and work here, and really pleased that many of them, the vast majority of them, choose to stay. And I think that must be testament to the support that we give people. Thank you. Right, any other business? I don't think we do. So in that case, I'll draw the meeting to a close. The next meeting of us as a single board is on the 6th of June at 1 o'clock. We'll be meeting as a group with our colleagues from the other 3 trusts in May, and invite anybody who'd like to join that meeting to do so. And my final word, I think, is it's the end of another financial year. Enormous thanks to all of our executive colleagues for their unwavering commitment and industry in what's been a very difficult year, and that cascade to every single member of staff. And also on behalf of Russell, many thanks to our non-executive colleagues who strive to bring the right support of challenge and support to executive colleagues on behalf of the members of the public that we're here to serve. So thank you all very much. For board colleagues, I suggest we have a 10-minute break, and we'll meet for those items of business that are confidential in nature at 2:30.